Greetings to one and all present. Welcome to today's PHYSIO TV classroom. Today we are going to discuss the role of different pranayama in stress management. So we all know that in today's fast-paced world, stress has become a common issue that affects the people of all ages and professions, and it has become imperative for us to deal with it effectively. And what better than pranayama, an age-old yogic practice that has roots in ancient India and has potential benefits in managing stress and improving our overall well-being. So we are delighted to have Dr. Sushma Kale ma'am with us for this topic today. Ma'am is a diploma in yoga education and counseling, and she has done a yoga instructor course and a certified QCI level 3 yoga teacher and evaluator. She is also a bachelor's and master's of arts in yoga shastra and is certified in naturopathy as well. She is a PhD scholar from Mumbai University and is also has enormous experience in teaching yoga. She is also the founder member of Sanskar Yoga Institute situated in Thane. Currently, she is the principal at Ternas Trust S. Padma Yoga Sadhana College, which is at Nerul. So thank you so much, ma'am, for coming over and giving us a talk on this topic. And without wasting much of our time, I would like to hand over to you.
Thank you, Palak. Thanks a lot. And first of all, thank you very much to Sanjayati Institute for calling me on this forum. And the topic is very, very popular, and in the modern era language, you can say it's a hot topic. Basically, it is related to stress. Everyone likes to talk about stress. It is beyond the age gap. It is beyond the education level. It is beyond the economic level. So stress is the topic which everyone used to talk about it, listen about it, wants the solution and whatnot. The very important aspect which we need to understand about stress is that one cannot avoid stress because it is a part and parcel of human existence, basically. If you just want to speak or you just want to inhale, we need stress. So stress is very much required for the survival of any being. Then why we are very much worried about stress? So we need to understand, first of all, what this stress is. So I'll just share one PPT with you. So before finding the solution in pranayama about stress management, I would like to just give you a short run about what this stress means actually. So this stress has different types or different definitions. A very simple stress, which we definition of stress, which we can apply in our day-to-day life is stress means speed, basically. So it is speed, or we can give another definition about stress is basically the gap between the expectation and actual the capabilities of the being. That is stress. So there are basically two types of stress, and you people are from health industry, so you know all these things, but just I wanted to go through with the terminologies related to stress. So there are two types of stress, eustress and de-stress. Eustress is basically useful for completion of any particular task. And de-stress is the same stress when the man will become inactivate or hyperactivate, or he go into sometimes in depression or anger, then it becomes de-stress. So it is the stress which has these two aspects. The same stress has two aspects. So we can use the stress for increasing our efficiency or the productivity, or we can, this stress is very much useful, or it will give you the negative impact on your efficiency and productivity. The same stress will develop, will help into the achievements of sports, into the achievements of your studies or the competitions, or different talent related events. And the same stress can induce a number of disorders, like all psychosomatic disorders we used to say nowadays. They are, the root cause of those disorders is in psyche or in the mental aspect, but it shows the symptoms at the physical level. They are the psychosomatic disorders or diseases. So these are the different types of stress. So as we all know, this stress is not only the byproduct of this modern era, but when people were staying in forest or they were Adi Manav, they were going through stress related problems, because that time they were not having shelters, they were not having security about the life, and that time also they were going through number of stress related situations. But that time their stress reactions were either fight, they need to fight with the wild animal, they need to fight or run away from the fire in the forest or in the search of water, or sometimes they have to fight. The flight is running away and fight is fighting with actually the involvement of physical muscles and the physical systems. So these are the natural stress reactions of any being. But nowadays, when we enter into stress, what we do, we switch on the AC, we switch on the TV, or we or turn on the mobile ka social media, and we start eating, and we'll try to deal with stress. So the natural reaction of stress is basically fight or flight. And in that case, we need to involve our physical body. But actually, in reality or in this era, what we do, we just sit on a sofa or bed and we start thinking about the negative thoughts one after another. We just try to terribilize the stress which is coming to us. So it is basically, these are the reactions. And after these reactions, what will happen, as you are health related students, so you know this channel, how hypothalamus work and how its impact on the different systems of the body. But it creates or it develops stress hormones. Then what to do with those stress hormones? So basically, those stress hormones will impact on the nervous systems, and that nervous system is sympathetic nervous system. Whenever there is a stress, the sympathetic nervous system will go high, and it will show you, or the impact of the systematic nervous system is there on the organs, the related organs, like your heartbeat, your blood pressure will go increase, your sweating will increase, the eye pupils and the things will dilate and you widely open the eyes. Your bowel mobility will get decreased, then constipation type of thing, your blood glucose will get increased, and such type of things. Muscle tone will increase and your lung air passage will widely open. So these all are the sympathetic stimulations for the nervous system. But exactly opposite to it, we have parasympathetic nervous system, which will exactly act opposite to the sympathetic nervous system, where we need to apply relaxation after stress. See, as I said at the beginning, one cannot avoid stress. We have to manage it. Means what? Stress will definitely come after. In every event, the stress will come. Just for example, suppose we have to catch a bus which is just passing through from bus stop, and we need to catch that bus. Then what will we do? We will run. We need stress in that case. We will run. We will activate our muscles. The total blood flow from other systems will rush towards our muscles. We will run. We will catch the bus, and when we will sit on the seat in bus, then we need to relax ourselves. Now the task is over. But what we do, we maintain that stress for the next upcoming challenge. And that is the problem which we are doing basically. So when we complete one task, one competitive task, we have reached the bus, we have catched the bus, and we are in the bus now. Now we need to realize that now I don't want to maintain that stress. I need to release it, and I need to that type of activity we need to do. And sometimes unknowingly we do that kind of relaxation, but unknowingly we do that. So instead of that, if we apply it knowingly, then that will become relaxation after every stressful event, because we cannot avoid stressful incidences of the life. we need to find out the gap between two stressful incidences, and we need to relax ourselves into that. Now, what will happen if we continue living that kind of lifestyle? That means we are always ready to fight with the challenge, one after another challenge, the stressful challenges. Or suppose we have a stress of our office, or the academic achievement ka stress, or the performance ka stress, then what will happen? Our stress level will go high, we will not relax, then the second incidence will come, then again it will go high, we will not relax, and again in third incidence it will go high. So that will happen, and it will happen for suppose 2 to 3 years. So that means we are prolonging that stress level for many months or years. Then what will happen? That will start showing symptoms at our body level. That means the stress is basically begins at the psychic level, but after some years, if we become habitual to do that, then it will start showing symptoms at the physical level, right? So the stages also you people know. First, it is at the psychic level. The root cause of stress or the tension is at the psychic level, but we continue that level, and we prolong that level for a number of months or the days or the years, then it will start showing its effect at the psychosomatic level. That means the tremors in the body, BP and whatnot, joint pain and whatnot, right? So it will get accumulated at some part of the body. For some people, it may get accumulated at the neck. For some people, it may get accumulated at the shoulders. For some, it is in the spine, or for some, it is in the lumbar, or it is in the knees or ankle, somewhere. Or many times it is at the face, or always at 100% times you can see the face immediately. You can identify the person is in stress or not, right? So this is the second level, psychosomatic level. Here also there are solutions to come out of this phase, but we people, we don't understand, and we continue, we prolong that stage, and then we enter into the somatic phase, where actually the symptoms are showing their results in the activity in the physical level only. Here also there are possibilities to come out of that stage, but when the fourth stage comes, that is the organic stage, there where the structural problems or the functional problems may occur related to a specific organ, then we may enter into a diabetes or the extreme stage of these diseases, right? So these are all are the technical terms, and how to cope up with those stress. We know we have a number of solutions. We have, as we are in modern era, we have availability of all kind of resources like this. So we may enter into smoking, drinking, sexual activities, or the diversion. We'll try to cheat ourselves. We will divert. We will watch movies. We will get engaged on the social media. But ultimately, when we'll realize these are the temporary solutions, we want something which is healthy and which will reverse our symptoms, okay? Or which may give us that intellect where we can nicely manage our stress, and we will accept it. And for that purpose, yoga, where the yoga plays a very vital role, and yoga plays a practical role in this kind of situation. See, when we try to understand the personality in Western culture, we know what do you mean by personality. Many times we say it is persona, it is a mask, and it is like we have to behave we have to behave like we are suitable in the society. So to maintain the suitability or the normality in the society, we behave certain behaviors. That is personality in Western culture. But what about personality in Indian culture? Before going towards pranayam, we need to understand why pranayam and how pranayam is helpful here. So this figure shows, this is personality of a human being. So our personality has total 5 aspects. And which are those aspects? The physical body, that is Annamay Kosh, the Sanskrit word or the Devanagari word, which is used for this physical layer or the physical shape of personality, is Annamay Kosh. Then the vital level or the vital layer, or it is called as energy layer, it is Pranamay Kosh. Then mental layer or the mental shape, it is Manomay Kosh. And then the intellectual layer, it is Vijnanamay Kosh, and the last one is Anandamay. It is a complete bliss. So these are the 5 aspects of any personality, every human being. And when these 5 aspects are going opposite to each other, they are not in harmony with each other, that time the thing which develops in our body is Vyadhi. That is Vyadhi. We all know disease. The disease has come from the Sanskrit word Vyadhi, basically. And Vyadhi is disintegration of all these 5 aspects of personality. When all the 5 aspects are going in a different directions, then it is disintegration of personality. It will lead us towards Vyadhi. And what will be the solution? The solution is always integration of all the 5 aspects. That means when our mind, our breathing, our body, and our buddhi, our intellect, they are in coordination with each other, they are in harmony, then the ultimate bliss we can enjoy, or we can, practically speaking, we can very well manage our stress in lives, right? And that level is nothing but integration of the personality. Integration is exactly opposite to disintegration. So Vyadhi ka, the opposite word or the meaning of Vyadhi is Samadhi. Sama, Adhi. Adhi is mind and Sama is balance. Whenever our mind is at the level of equanimity or the balanced state, then it is called as Samadhi. And that Samadhi equals to yoga. So that doesn't mean with the help of pranayam, you will directly lead towards samadhi or you want samadhi. So you just forget about these words. These are the actual words given in our scriptures. But in our modern era or day-to-day language, we can say just the integration of personality, or you can say the balanced personality or the developed personality. Now here in these 5 koshas, if you observe carefully, you will see that Manomay Kosh, which is the root cause, which is in the center, which is the root cause of all kind of stress and tensions and all the diseases. Okay, so that level is the level where our stress begins. We need to stop or avoid our stress at the mind level, but obviously it is not possible in this modern era. So it will enter into our body, but in between body and mind, there is one level, and that layer is nothing but pranamay layer or the pranamay kosh. So where we are working for mind as well as body, because stress begins at mind and it enters into body. In between, there is one layer or there is one kosha. This is pranamay kosh, where our prana stays. So due to stress, we are disturbing our prana, or in simple language, we are disturbing our breathing. For example, if you want to run and if you want to climb a 5th floor, what will you do? You will just start running and you will reach the 5th floor. Then what will happen to your breathing on in that whole journey, or when you reach the destination? What will happen to your breathing? You can actually feel that you are shallow breathing or fast breathing. That means your natural process or the natural level of breathing is disturbed, right? But if you're sitting in a complete AC and a comfortable room, and if you recall something, or if you remember some event where you got insulted and all, you got insult, so you will remember that insult and you will you will become angry. And in anger, what will happen? Again, your breathing will get disturbed. That means you have actually not done any physical activity, but in the sitting posture itself, in the relaxed posture itself, when you develop the emotional imbalances, you can immediately see the effect of that emotional imbalance in your breathing. So your breathing will get disturbed first, and then it will start disturbing your body. So that pranamaya kosh, which is very much in between mind and body, which is actually affecting your body in stress. And when you do pranayam or such practices, it will help your body and mind to calm down. Getting it? From here, our actual pranayam topic we can start. So basically, so there are a number of therapies, integrated approach of therapies in yoga. Why integrated approach? जैसे मैंने कहा कि we have 5 aspects of personality. When your mind is disturbed, it will disturb your breathing, and then it will disturb your body, and your mind will disturb your intellect as well. That means you are not in that position to understand what is correct and what is wrong, what is right and what is wrong. And that means your mind will disturb your prana as well as your intellect, and the whole progress towards disease will begin from here. So for that purpose, if we just do exercise, that means we are giving therapy for our body. If we do just a pranayam, that means we are giving therapy for our breathing. If we'll do just relaxation, we'll switch on the music and we will listen nice Bollywood or classical music, that means we are giving relaxation to the mind. And if we'll start reading some scriptures or the motivational books or the books of moralities and all, that means we are giving a therapy to the intellect. But what about the integration? For that purpose, the yoga plays the role, which is actually the integrated approach of therapy. So I will definitely not advise you people to directly begin with pranayam if you do not have any kind of practice about asan or the related practices of yoga or the preparatory practices for pranayam. You cannot directly go start pranayam. So what is the solution? We have a solution for that. The very first key for stress management is relaxation. Relaxation, relaxation, and relaxation. So why 3 times? Because relaxation is required at body level, at prana level, and at mind level. At 3 levels, the relaxation is required. And that as the prana level is in between, if you just relax your breathing, you can see the relaxation impacts on the mind as well as on your body. Okay. So these are the slides related to those therapies which I'm giving you. So the basic principle or the outcome from this integrated approach of yoga therapy is what? Samatvam yoga uchyate. It is the perfect balance at all the levels of human personality. And that is nothing but yoga. That is the simple definition of yoga. Samatvam yoga uchyate. And this beautiful definition is given by Bhagwat Geeta. So in Bhagwat Geeta, Bhagwan Shri Krishna has given this definition. And this is the definition about health in WHO. WHO says health is a state of complete physical, mental, social, and spiritual well-being, and not merely the absence of disease. So only the absence of disease is not health. If we are fit at the physical level, mental level, and social level, and even spiritual level has also added, it is removed again, but it is true, then it is health. That means that integration or samatvam or the balance is accepted by WHO as well. And this is basically, you can see the cause stress at mind level and how it reaches to the body level. This is a very beautiful verse from Bhagwat Geeta. I know you people are not, at this stage at least, you are not interested into looking at the scriptures and all, but that doesn't mean the solutions and the problems are not given in the scriptures. So this is the scripture which is written 2000 years back, and they have given the complete flow chart about stress. So how stress, where stress begins and where it enters at the end. It says the hayanto vishant punsat sangas teshu pajayate sangat jayate sangat sanjayate kamaha kamat krodho vijayate. That means if you have attachment towards the object, then it will lead you towards the desire and that strong likes. I want it in any situation. I don't want it in any situation. Such types of strong likes and dislikes will lead you towards anger. And this anger, obviously, krodhat bhavati sammohat smriti vibhramaha. When you are in anger, you will just forget about what is good and what is bad. Sammohan, you are hypnotized by the extremities of the emotions. And then you will lead to the loss of power of discrimination. What is right, what is wrong? Kya sahi hai, kya galat hai? Wo bhi samajhna bhul jate hain. And finally, you get lost. So it is your own nash. You will destroy yourself. So only single stress will lead you towards this situation. And this shloka is written in Bhagwat Geeta. Then what is the solution? The very simple solution is control, alt, and delete. Control yourself, alter, and leave the different alternative solutions and delete the situation which you are going through. And for that purpose, the solution which I would like to explain you about pranayama. And for that purpose, I have a different slide. I will just share that slide with you about pranayama. Yeah, just a minute. Yes. So these are some basic practices which has come from Hatha Yoga or the yogic, different yogic scriptures. So first of all, we need to understand what do you mean by pranayama, because prana plus ayama is pranayama. Prana means the vital energy, the force, at the gross level we can say it is breathing, at the subtle level it is prana. But the manifestation of prana is nothing but breathing. So at the practical level, or for the simplicity, we can say it is breathing. And ayama means controlling. So we need to control prana. Why? Why we need to control our breathing? Because our breathing is in between. As we have seen, there are 3 layers. It is in between the body and mind. When your mind is disturbed, your breathing is disturbed. When your body is doing a very stressful activity, your breathing is disturbed. The same breathing can give relaxation to the mind and to the body if you control it. So before controlling, we just need to become aware of it. We all know that we are breathing, but are we really aware of our breathing? When we inhale and when we exhale, how we inhale and how we exhale, just try to remember that. We will find that I don't have to worry about breathing. It will just come and it will go. Yes. But if you want to do pranayama or you want to do breathing control, before controlling it, we need to become aware of that prana. So becoming aware of the prana is nothing but the beginning of pranayama or the preparatory practices of pranayama. And as everyone knows that preparation is more important than the actual practice. Because in actual practice, you will enter in the fraction of second. But before that, we need to spend number of days and months and years for the preparation. So preparatory practices of pranayama are really, really important. You cannot directly enter and start doing pranayama. It's not possible. And one should not do that, right? So there are basically 3 aspects of any preparatory practices related to breathing. One is we need to inhale. with the awareness, when we inhale, we all know that there is a gap, or there is a partition between abdominal cavity and chest cavity, or the thoracic cavity, and that is diaphragm. That diaphragm is a flexible organ which goes inside or downward, which goes downward when you inhale. Why it goes downward? Because there we required, our lungs required a space to get expanded. For the expansion of lungs, that diaphragm should go down, and when our diaphragm goes down, our abdomen should come out. So abdominal breathing is very, very important to begin or to start practicing pranayama. So again, the preparatory practice. See, because first very important practice is becoming aware of the breathing. So what is my rate of breathing in this moment? That means in 1 minute, how many breath I take? So in healthy body, normally 15 to 16 breathing in 1 minute. That is the natural or the normal count for breathing. But whenever you are in stress, your breathing rate automatically increases. We have seen that. Okay. So we need to become aware, first of all, whether I am in stress or not, whether my breathing is disturbed or not, because awareness or the recognition is half the solution. If you recognize that, yes, my breathing rate is very fast or high, now I need to become aware. You cannot directly stop your breathing. So you need to become aware of the breathing. And once you become aware, you start observing your breathing, how I am inhaling, while inhaling, whether I'm expanding my lungs, whether I'm bulging my abdomen out or not, we need to observe that. And when we exhale, whether I'm exhaling completely. See, because exhalation is more important than inhalation. Inhalation is taking in, the air taking in, and exhalation is releasing it out. And as we know, releasing is relaxation. We need to release. We need to relax with the help of breathe out. We need to release it. We need to let go. So the more emphasis is given to exhalation than inhalation in pranayama, or the before or the preparatory practices of pranayama. These are the 5 functions of pranas. These are not really important basically. Yeah, the principles of pranayama, very, very important. Practices though you can watch from any YouTube video, or you can ask to any yoga teacher, but the very important practices we need to keep in our mind while practicing pranayama is slow breathing, or you can say slow and rhythmic breathing. Slow doesn't mean short. Slow is complete. In fact, it is long. So slow breathing and rhythmic breathing is the first principle. Rhythmic means, suppose if you want to inhale, suppose 100%, then if you will count 4, then in first count, you should inhale 25%. In second count, the next 25. Then in third count, the next 25, and the last 25 in the fourth count. That way, it should be rhythmic. That doesn't mean, le liya bas, aise nahi. We need to count it, suppose for 4 counts, then it should be rhythmic and with the proper proportion. Then it is called as slow breathing. Second principle is long exhalation. If you are counting 4 counts for inhalation, then we need to count 6 or 8 counts for exhalation. So we need to lengthen the period of exhalation. So inhalation अगर हम करते हैं तो exhalation उससे double होना चाहिए. So we need to double the counts for exhalation, but do not force yourself. यहाँ पे in principles of pranayama, forcing yourself is not at all allowed. We will not at all force, because everyone's capacity, everyone's physique is different. There should not be a competition कि मेरा इतना होता है, 8 होता है, मेरा 16 होता है. No, that competition should not come in inhalation and exhalation. And the last principle is should be deep and continuous. If we need to continue the breathing rate for the longer period, then we will not force or we will not torture ourselves. If we torture, then it will be there for the short period only. Okay. So for the longer period, if we need to continue, then we need to follow first two principles: slow breathing and the long exhalation with your own capacity. Very important mantra for all the yogic practices is Yatha Shakti Nirantara. Yatha Shakti means as per your capability, and Nirantara means without any break. So Yatha Shakti is the condition, or you can say it is the discount. Instead of condition, we can say Yatha Shakti is the discount. But Nirantara is the forceful condition. We need to continue the practice, but as per your capacity. Very, very important. So when we inhale, if you are sitting, you cannot identify or become aware of the movement of the abdomen. You just lie down wherever you are, on the bed, on the mat, or the floor. If you lie down and you observe the changes, you can actually observe that when you inhale, you can see in this diagram, the diaphragm goes downward, the abdomen bulges up, and your lungs expansion possibility is more. And when you exhale, automatically your diaphragm goes upward. It will reduce, or it will contract the lungs, and the abdominal muscles will go inside. So this is the simple preparation for pranayama. In fact, this is pranayama. Okay. So this principle, if you follow, then you can go for any kind of pranayams. So सबसे पहले you need to understand कि pranayam doesn't mean holding the breath. If you start holding the breath, then it will harm you. So don't stop your breathing. Just continuous, slow, rhythmic and long exhalation wala breathing is pranayam. Now we'll try to enter into the actual pranayam. And before pranayam, we need to adopt certain postures. Now you will say कि वज्रासन में तो हम बैठ ही नहीं सकते. It's okay. If you are sitting on the chair, it's okay. If you are sitting with the folded legs, that is also okay. That is Sukhasan. If you are comfortable with Vajrasan, then it's good. Otherwise, Padmasan है, Siddhasan है, कुछ भी नहीं होता है, तो आप जैसे बैठ सकते हैं, आप बैठो. That's it. Do not force or torture yourselves. Adopt any sitting comfortable posture, and then the whole structure of pranayam is this. Actually, this is the theoretical session. If we'll get a chance, then we'll try to conduct a practical sessions as well. Actually, the pranayam session starts with the prayer. Prayer is the opening of any kind of practices, and it is important. Okay, so prayer will make you aware about your practice. Otherwise, we all are working out. So workout nahi hona chahiye. It should be work in. We should internalize ourselves while practicing any kind of pranayam or any yogic practices. So it will start with prayer. Then Kapalabhati. Kapalabhati to naam aap sabko pata hai. It is forceful exhalation. So we will do forceful exhalations. There are certain limitations for Kapalabhati. We will see in the upcoming sessions. We'll try to see that. Then sectional breathing, very, very important, where we all know that there are three sections of the lungs: the lower lobe, the middle lobe, and the upper lobe. We normally use the middle lobe of the lungs. And that is the problem. We know that whenever we don't use anything, that thing will get vanished. So if we are not using upper and the lower lobes of the lungs, what will happen? They will become stiff. Like that's due to that stiffness, they will become like we are not using them. So they are non-functional now. So to rule out all these possibilities, we need to continue with the sectional breathing. That means when we breathe, we become aware of the abdomen. For some breathe, then we'll become aware of the chest expansion, and then we'll become aware of the changes or the movement in the shoulders. Simple. When we inhale, our shoulder goes up, our chest expands, our abdomen comes out. And when we exhale, our abdomen goes in, chest comes down, and our shoulders become relaxed. So this is sectional breathing. Then the actual pranayam will start. these are the number of pranayams, like नाड़ी शुद्धि प्राणायाम, या फिर आप लोगों ने अनुलोम विलोम प्राणायाम सुना होगा. It is one and the same. अनुलोम विलोम. That means, well, when we inhale with the left nostril, we exhale with the right. Again, we'll inhale with the right and exhale with the left. Alternate nostril breathing is anulom vilom. And it is just for the balancing. Because as we are becoming aware of the breathing, now we need to balance our breathing. And this is this anulom vilom or alternate nostril breathing. And the balancing breathing will balance your left and the right brain hemispheres as well, or it will balance the sympathetic and parasympathetic nervous systems as well. So it will work on the balancing of brain activities as well as the sympathetic and parasympathetic nervous systems activities. Then we have different pranayams like Ujjayi pranayam, or we have cooling pranayams like Shitali and Sitkari pranayam. Then very beautiful and the soothing effect dene wala pranayam is Brahmari pranayam. It is like a humming sound. We need to just do humming sound when we exhale. जब भी हम सांस छोड़ते हैं मुंह बंद करके, मतलब we are just chanting ma with closed lips. That is humming sound wala pranayam, that is Brahmari pranayam, and it will give soothing effect to all the nerves and the brain centers. And then we have complete silence. That means what? The pranayam will lead you towards dhyana automatically, without knowing or unknowingly or without any efforts, without any prayas, you will enter into dhyana. And that is the silencing your mind and body. And then the closing prayer. So this will be the whole structure of your pranayam. So that is the importance of pranayam whilst managing stress. These all pranayams are explained here as well. But the prayer which I would like to tell you at the beginning of pranayam is very, very important. It is Pranas Sedam Vashe Sarvam Trivideyam Pratishchitam Mateva Putran Rakshasva Shrishcha Pradnyanscha Videhinati. That means this is the prana Shakti, and I am bowing down to that prana Shakti which is there in all the lokas, which is there in all the object of the universe. So prana Shakti is always there in all the objects, and I want Pradnya means the knowledge. I want Shri means prosperity, and I want healthy life. And I am asking Prana Shakti to protect me in this life. So that is the prayer, that is the meaning of this pranayam prayer. And it will internalize, or it will develop your attitude towards pranayam. See, everything matters, like attitude matters actually. When you start practicing, you need to become that. Then only the practice will give you the fruits. And the stages which I was telling you about, Kapalabhati, then the sectional breathing, abdominal breathing, thoracic, clavicular, shoulder related, and the complete breathing. This is sectional breathing, where all the muscles, related muscles will get involved. And the stress which is accumulated there actually will get released. So that is the technology behind pranayam. So pranayam is not the practice which is there in the scripture, or it is there in somewhere in the yogic culture. No, it has the technical background. It has the technical evidences basically. So these are the breathing types, or the preparatory breathing practices we need to develop, we need to practice, and then we will start doing pranayam. And before that, some breathing practices are also I have mentioned, like just stand at place wherever you are, hands दोनों हाथों को ऊपर, hands side में out and in, इस तरह से भी आप breathing कर सकते हैं. So it will stimulate our related muscles to expand and to contract, and it will develop your habit or the attitude towards pranayam. आप सीधा सिटिंग पोस्चर में बैठ के टाइगर ब्रीदिंग या जो जिसको हम कैट का ब्रीदिंग बोलते हैं वैसा वाला ब्रीदिंग भी कर सकते हैं. We have a breathing where we are expanding our chest and we are contracting the chest. That kind of breathing you can practice. So there are some breathing practices which we need to practice. These are some examples I'm giving you. Expansion and the contraction. And then the actual pranayam will start. जैसे मैंने कहा कि नाड़ी शुद्धि प्राणायाम और अनुलोम विलोम प्राणायाम, then ujjayi pranayam, शीतली सितकारी pranayam, and the brahmari pranayam. So what will happen? So it will slow down your breathing, it will balance your energy, and it will cut the connection between vyadhi and adhi. Means from vyadhi you will lead towards health. Samadhi means health, and it will promote the positive health. That is basically the objective of the all the practices of yoga, and basically the pranayam practice, because it is the bridge gap between stress at mind level and the body level. As it is a bridge gap, it will get disturbed, the prana will get disturbed because of stress, or vice versa. The same prana will release your stress from body and mind. So we need to use that technique, and that technique is in pranayam. And very important, the very last shlok which I would like to tell here, it is the precautionary measure. Pranayamena yuktena sarva roga kshayo bhavet. If you perform or you practice pranayam with the right method, yuktena, with the right method, with the proper teacher, sarva roga kshayo bhavet. Sabhi rogo ka nash ho jata hai. All the diseases will vanish. Otherwise, ayuktabhyasa yogena, if you practice pranayam in the wrong method, sarva roga samudbhavaha. So all diseases जो नहीं है वो भी होने की संभावना है. So we need to be very careful while practicing pranayam. We need to learn it properly, technically. As you are a students of health related industry, you people will definitely learn the pranayam with the proper teacher and with the proper technique. And that precautionary measure we need to keep in mind. So here, these are the practices only. And the very last shloka is Shanti Mantra. This Shanti Mantra is there in all the scriptures. Om Purnamada Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnamevaya Vashishyate. Om Shanti Shanti Shanti. ये 3 बार शांति हमेशा होता है. Why? Because Shanti, relaxation at body level, at prana level, and at mind level. So these 3 layers where stress has impact, and the 3 layers which we need to relax with the help of pranayam or the pranayam related practices. So that is all the solution which is there in the pranayam. If you learn it properly with the proper teacher and the technique, then it is a boon for stress management. So I would like to stop here. Thank you very much for listening to me. Thank you.
Thank you so much, ma'am. Insightful talk, and it was very interesting to know more about stress and the simpler techniques of pranayamas to deal with it. And I'm also very sure that it was very helpful for all of us to relieve our stress. And so thank you once again. And with this we will end our talk for today. So a very big thank you to all our viewers, and I hope you all will have a nice and stress-free day here on. Thank you so much.